welcome to the Joe Cortez Healthcare Talk Show here in Las Vegas, Nevada, with my co-host, Sam Billig. Sam Billig is the director, CEO of the PAM Rehab Medical Center in Las Vegas, Nevada, up in Centennial Hills. I can tell you that, Sam, what you're doing with the rehab location is really marvelous. I mean, I've been there. I'm a patient there myself. I go down on a regular basis after my COVID situation, which we'll talk about it more on the show. But tell me a little bit about yourself.
A little bit about me. I'm a therapist by background. I've been in healthcare administration over 20 years. I've been with the PAM Health Corporation now for a little over 2 years. I've been a CEO for almost 10 years of various rehab hospitals across the country. And now I'm here in Vegas, and this is where I love to be.
Okay, great. What got you into healthcare?
Coming into, I decided to go to school to be a therapist. So in physical therapy, of course, it's all about rehab. Patients who suffer from strokes, Parkinson's, amputees, and really love the senior population. They're my heart. And started out my career in acute care. I did skilled nursing, I did home health, and then ventured into hospitals. I took a job as a director of business development at a long-term acute care hospital, and those are hospitals that patients are there for 25 to 30 days and on. Typically they're on a ventilator, maybe they have a lot of wounds, a lot of IV antibiotics. So I did that for a minute, and then I was promoted to be a CEO, and then transferred over to a rehab hospital.
Okay, so how long you been a CEO now? How many years?
Over 10, yes.
Really?
Yes.
Okay, so tell me a little bit about the PAM Rehab location.
So our location is in Centennial Hills, not far from where we're here at the studio, which is very exciting. We're 44 beds, all private rooms. As you can see in our photo, it's a beautiful, beautiful facility.
It is.
Palm trees around, sunshine all the time. All private rooms and a fully dedicated therapy team as well as nursing team.
Okay, how is the rehab, how is it impacted with the pandemic that's out there? And the services that you provide there, I mean, it's a lot. I could talk a little bit about it, but I'd rather you explain to our viewers a little bit about this whole rehab location. It's fabulous, probably the best in the country. Tell us a little bit about it.
Thank you. So again, 44 beds. Patients are typically with us about 10 to 14 days on average, depending upon the severity of their illness. Some stay longer, some shorter. One-on-one therapy, 3 hours of therapy a day, 5 days a week. And of course, dedicated nursing team, therapy team, dietitian, respiratory therapy is big now, especially post-COVID. A lot of our patients require respiratory care, as you did as well when you were with us.
Okay, so there's been a lot of changes with the healthcare because of the COVID. There's been a lot of changes applied in the program there, we say?
Yes. Just social distancing in the therapy gym. So we need to make sure that we space everyone out when they're in their therapy program, because it's really hard for patients to wear a mask, especially if they're respiratory compromised. So making sure that we social distance. Of course, visitation was impacted during the beginning of the pandemic. So not allowing visitors and families to come and visit with their loved ones was very hard. It was very hard for everyone. So we did window visits with their families. We set up stations at the hospital. We were actually on the news, Fox 5, a couple times for some of the things that we did to kind of connect the families with the patients in the house.
Well, let me tell you, I've experienced that myself. While I was in the hospital, I mean, I couldn't have no visitors. It was very difficult. And, I spent a long time in the hospital, 5 months to be exact. And that was really tough. But that's why I tell the people out there, get vaccinated. So important because keeping the distance, but also, just be aware and never bring your guards down. Always keep your guards up at all times, like we say in boxing. But this program that you're involved with, Sam, is something that's really very, very well needed in the community. And in the country, we have rehab locations with other locations. I've never seen anything like this. But it's first class. How did it get to that level?
I'm there. No, no. To that level, we have a great team, very dedicated team, and we really had to look outside the box and look at ways to really service patients post-COVID. So we didn't admit any patients with COVID who were active. So someone like yourself, you were no longer positive. You needed that rehab stay, right, to get stronger, to be able to go home. So it's really important to develop a program to help support patients through that process, through that long hauler period. So developing a really, really strong respiratory program was important, partnering with companies in the area to make sure that we had programs and services and devices that could support to help wean patients off oxygen, especially if they were on high flow. You actually were on some of our devices as well and went home with them. We actually developed a cardiac rehab program, a pulmonary rehab program, both on the inpatient side as well as the outpatient side. So when patients leave us on an inpatient side, they can come back to us and continue their rehab outpatient like you do today.
Right. Now, we know you take care of a lot of COVID patients, but you also have a lot with strokes,
Yes.
heart conditions, a lot of things that goes on. Tell us a little bit about the other part besides COVID.
Absolutely. So with our stroke population and our Parkinson's, TBI patients, spinal cord injury patients, we have a lot of specialty equipment, resources, and technology that can really help improve quality of life. We're the only ones in the state of Nevada that have the exoskeleton, and I think we could save that for a whole new show later on in the future. People can tune in and we can bring some patients who've actually had success with the exoskeleton. It's an amazing piece of technology.
Yeah, very good. We're going to be doing these shows on a weekly basis because we want you viewers out there to understand and learn a little bit about what goes on with rehab, because we know about going to doctors for a doctor's appointment, going to the hospital for a checkup, whatever. But when it comes to the rehab, it's a different feel altogether. And I feel that this is what we have to educate our viewers out there about, because we have our loved ones or ourselves that have issues that we don't know about, and we address it here on this show.
Absolutely.
And if you have any questions, you can call in and we'll be more than glad to give you information. Can you tell us a little bit about if they wanted to contact your rehab location, where can they go online or phone numbers?
So our website is pamhealth.com, and of course our phone number, our main line is 725-223-4100. Always can stop in for a tour, come see the facility, meet with our staff. We're always welcome. Of course, you need to wear a mask and be screened upon entry and have your temperature taken. COVID has changed a lot of that in just the way that we offer tours. We have to make sure that everyone is screened prior to entering.
Right. Now, what do you think about what's going on there in the community today? A lot of politics are involved with the vaccines and whatnot, and we're trying to stay away from that because we're not talking about politics. We're talking about your health, to care for yourself and your loved ones. What advice can we give our viewers out there, the right way to go without politics, because we don't care about that. We care about our lives.
That's right. I think what we can do is educate everyone to make sure that they do seek medical care when they're not feeling well. We've seen recently patients that we admit have stayed at home way too long because they were afraid to go out and seek care. They were afraid to go to their doctor's office. So now a lot of things have exacerbated. COPD, CHF, UTIs, altered mental status. They're not drinking enough water because they're always wearing a mask.
Right.
So therefore you have to take the mask off to drink something. So you see a lot of dehydration going on right now. So falls, and they're afraid to go out of their home.
I'm talking about water, because a lot of folks, they all have a glass of water once or twice a day. How much water should a person be drinking on a daily basis?
Well, they say, 8 to 10 glasses. I don't drink enough water. Now, if I include my coffee, my iced tea, maybe my drinks at night, maybe I'll get to that. No, I'm kidding.
When she said drinks, she's talking about Coca-Cola drinks.
Sure.
And 7-Up drinks.
Sure.
But anyway, we want to make sure that we get the message out there, because this is so much needed these days. Because people are staying home too much. And one of the things that's also affecting is the children. Children are also being affected by this because they're not having their leisure time that they did before, going out and play, because the parents are afraid that they can bring something home.
Right.
They may catch it from another kid playing this. What can you tell us about these young folks out there?
Oh boy, they still need to be children, in my opinion. Do the best that you can and social distance the best that you can, and keep that hand sanitizer everywhere, and make sure that, if you do have children over, make sure you clean and do some infection control when they leave. I think that's very important, is to maintain infection control practices.
Yeah. It's not easy, trying to get these kids to understand that, because their mentality is different than ours. Eventually they'll learn, but actually you have to start somewhere with the kids. They have to learn to follow orders, like we have to follow orders from our doctors. Doctors say you got to be drinking a certain amount of water, you got to be eating properly. What can you tell us about the type of vitamins that we should be taking to enhance our immune system?
Oh, I can't help with that. I'm not a physician. So as far as vitamins, I think you just need to follow, the advice of your physician, and making sure that you stay healthy, get your lab work done. Sometimes you might not know that you're deficient in something until you get your blood work done. And then all of a sudden you realize you're vitamin D deficient, right?
Right.
Because we're not going outside as often as we were.
Exactly.
So there's things that you can do, but seeking medical care is very important, and not waiting too long. And I think that's what's happening right now, is people are waiting too long.
Yeah. I think that, listening to the news and, again, stay away from the politics about when it comes to healthcare. Listen to doctors that know what they're doing, and they're going to give you the proper advice, because we want to do the right things for ourselves and for our loved ones. But we have friends I have friends that refuse to get vaccinated, and I say, unfortunately, they can't join me,
Right.
We cannot be together because we're afraid. And what I experienced wasn't easy. And I can tell you one thing is that if you follow the guidelines, the healthcare guidelines, go onto the website for the Pan Rehabilitation Hospital of Centennial Hills, you'll learn that there's a lot. Go on their website, there'll be topics talking about the facility, but eventually, I don't know what you have on your program now. You have any advice, a program, a segment in reference to healthcare, what they should be doing and not doing?
Sure. So, looking at, even if you don't need inpatient, we have outpatient therapy, making sure to remain active and mobile. So when they find that they're having a hard time getting up from the chair, or they're not making it to the bathroom in time, right, because it's taxing and there's a lot of effort, or they're not eating as much because they can't get to the kitchen to cook a meal, that's when it's time to seek help. Whether you want to come for outpatient therapy, or we even have the telemedicine option. So we can do telehealth PT or OT. We've done some telehealth dietitian visits, so making sure that you are healthy with your diet, especially your congestive heart failure patients.
Right.
Monitoring your weight is important for those patients. So we have those resources to be able to do a televisit as well. So it's important, if you're afraid to come out, we still have that option. We do cardiac rehab, as well as televisits for pulmonary rehab.
Good. See, that's information that you guys got to learn about with that goes on with the Pan Rehabilitation Hospital of Centennial Hills. It's a lot of stuff that goes. That's why I want you to watch this show on a regular basis, on a weekly basis. We should be on Fridays, and this show will enhance your ability to learn more about taking care of yourself and your loved ones. Because what's going on with this pandemic is very, very serious.
Yes,
this is the worst I've ever seen in my lifetime.
It is. So why don't you share with everyone your experience at PM Rehab?
Well, when I was a patient at the hospital, then I was there for 5 months, and then I was transferred over to the Pan Rehabilitation Hospital. I was there for a couple of months as well. And this is a place that I felt like either I'm going to make it or I'm not going to make it. At this place, they were giving me the vote of confidence that I was going to be okay in due time. And believe me, a lot of it is mental, but a lot of it has got to do with the support and the prayers from your loved ones and your friends from all over the world reaching out to me to making sure that I made a full recovery. And I'm 99% there.
I know. I was in the ring with you a couple of weeks ago. So what about the pulmonary rehab program when you came back for outpatient initially?
Well, it was a little bit tough at the beginning because I was doing stuff I didn't do before. But the exercise and the weights and all the balancing and all the strengthening, the bicycle, the arms, everything, your whole body is worked out on a regular basis. And these therapists you have there, they're like our guardian angels.
They are.
I would say, because they bring you back to life. They give you the vote of confidence. They talk to you so professionally. They give you while you walk out of that place thinking, well, I'm going to make it. and it's true. They make you feel good. They ask you all kinds of questions. They want to know where you're at mentally, physically, but a lot of it got to do with when you socialize with them, it gives you feel like a family, and that's why we're here at this show. We're talking about this because I got a love for this PAM rehab hospital. It's just amazing.
So do you have a favorite therapist or two?
To me, they're all my favorites because
Okay.
they're all, the guys, Jason, and you got Carla, and you got TK.
TK.
And there's so many, and Mike, there's so many other therapists that are excellent. They do great work. And then when you come into the reception area, the girl that meets you there at the front,
That's
Frances,
right.
she's adorable. She got married recently. Good, congratulations on that. And I feel very, very special being a patient there. But I said, well, I got a show that I've been doing before, more about boxing than anything else. But now, being that I got gravitated towards healthcare and being the situation I went through, I think it's my duty to go out there and give information to our viewers. And that's why we have Sam as one of as my co-host for this show on a regular basis to be talking to you weekly. We'll have doctors, we'll have therapists, we'll have all kinds of individuals come here to talk about this healthcare to keep your life on the top level.
Absolutely. Now you're continuing with us just on physical therapy with TK. So it's been a year battle for you.
Yeah, it's been a year now. A couple of days from now, it'll be a year when I was diagnosed. But I've been out of the hospital since March of this year. So it's been a good almost a half a year out of the hospital. So it's been pretty good. And I feel like I still got a little spark of the old Flash.
And I think it's also to note that when you did go home, you went home on oxygen.
Right.
And that was taxing as well, to making sure that you have all those tubes and making sure that you have the concentrator and all the equipment. And when you leave the house, you have to have the portable tanks.
Right.
So talk about how much effort it takes to actually have to go home with oxygen.
Well, it was tough, but it gives you a sense of relief knowing that you got a backup in case you need it, And I still walk around once in a while. When I go to different locations, I take my little portable oxygen concentrator, just in case it's battery operated, just in case, it give you a sense of relief knowing that if anything goes wrong, if I get winded, I can't continue, I put on my little tubing around my nose. I get a little.
Do you carry it with you usually?
Only when I go out of the house, yeah.
Okay.
And that's just in the next couple of weeks I'll be off everything. It's just a lot of it's mental too, because like I said, you get a little winded, it's normal. When you're just new out of the hospital like myself. But I think that in due time, hopefully in the next couple of months, I'll be back in that ring, moving around like I used to, like I do, like as a referee. I've been retired as a referee, but like I say active. My therapist told me like yesterday, TK was telling me, Joe, you got that New York walk. You kind of walk a little too far, too fast. You gotta kind of take it easy a little bit.
Right. You do have to take it easy to some degree. I think you can outrun me, that's for sure, especially in the ring.
In the ring, maybe.
In the ring, for sure.
Yeah, but she told me one day, the right one get you, the left one will. I saw a little video of Pam doing a fundraiser at with Richard Steele, the referee.
Oh, yes, I did send you that.
Yeah, and that's why I was kind of impressed. I mean, you guys are little boxing skills.
I try, just a little bit. I think I have a good coach here that can teach me a little bit more, though. Sure.
We're so happy to be able to talk to you guys about healthcare. Something different for me, even though I've always had I've been a little bit leaning towards healthcare for many years before the COVID, because I was appointed by the governor for two terms. I was one of the board members of the Nevada State Nursing Board, and I was appointed there, and it was a good position to have. I held out for about a good 5.5 years. But I always liked the healthcare. I thought that nursing here in the state of Nevada is very, very important. And I liked when I was in the hospital, I saw what they were doing. It was just really, during this pandemic, it was difficult. We didn't have enough help in the hospitals with the nursing, But I see at your facility, the rehab, I see every position is taken pretty good. You guys are doing a hell of a job there.
It's hard at times, right? Our nurses are exhausted, right? They're tired. Some work more than one job.
Yeah.
They support families elsewhere.
Yeah.
They send their paychecks somewhere else. So, they're tired, they're exhausted, and, this pandemic hasn't stopped. We really haven't had a break.
Yeah.
So I think it's important, as a patient sometimes to be patient, right, with your caregivers, because they truly are doing the best that they can with what the supplies and the tools that they have. We've been blessed at PAM, with an amazing owner, Tony Misitano, who has made sure that we've always had everything that we needed through this entire crisis. We never ran out of anything, any PPE. He kept us safe. Everything that we needed, we had within a day, if not hours. So we were able to take good care of patients like yourself and get them through those tough times and help the families as well, because I think they also suffered during this, not being able to visit, not being able to hug, not being able to participate, with things. Luckily, your wife was able to arm wrestle me a little bit, and I let her in, because she's a very special person. And you have an amazing family who were there to support you, and there's so many people that don't have loved ones. So during the pandemic, when everything was closed, we were their loved ones, we were their family, because they didn't have anybody else.
Right. I can tell you that. I can vouch for that for sure, because I feel like every time I saw a nurse coming through the room, it was always that special treatment. Even the person that came around to empty out the garbage, to clean the room, whatever, I treated them so well, because I love people in general. But when you're in the hospital, you have no visitors to come in. My only visitors was the nurse or the person to come and clean up the room. And I love them all. They were just giving me that feeling of they'll sit with me, talk with me for a little bit, and it was very special. I got the best treatment in the world. The Penn Rehabilitation Hospital was the best. Yeah.
I'm glad, and I made a new friend with you as well. So, sometimes crisis and hardships turn out to be positive, right?
Exactly.
So I wouldn't be here today with Joe and as his co-host if you wouldn't have been with us at PAM. So.
Exactly. Well, God works in mysterious ways and puts us out there to talk about different topics, but this is very, very health. Without health, you have nothing. You need health to get on with your life, to get where you want to go. Sometimes you want to reach the pinnacle of your life. You want to get to the top, and sometimes when you don't have health, good health, you're lost. And that's why I respect anybody in the healthcare business like yourself, the doctors, the nurses, all these caregivers. To me, they're very special. I look at them, like I said before, they're like guardian angels. They're the therapists that are working with me today, because they got me to where I wanted to be. I lost 40 pounds when I was in the hospital for those 5 months, and I've gained back half of that already. My doctor said, stay the way you are. You're okay right now. I feel good, but that's not the way you want to lose weight.
Right.
You want to lose weight by eating properly and exercising right to make sure you stay good and healthy.
So I know we have big plans for this show moving forward, right? We have a lot of topics that we want to discuss. We want to bring a lot of guest speakers on, some experts to kind of guide and coach our community, our Las Vegans especially, into living that healthy lifestyle, right? And looking at healthcare as an opportunity and a resource, and making sure that they're not afraid to go and see their doctors again.
Exactly. Now, there's plans of opening up a new location in the near future, I understand?
Yes, there is. So we have property in Henderson, close to Henderson Hospital on the corner of Boulder and Gibson. So we hope to break ground here soon. So it'll be a 48-bed rehabilitation hospital, just like the one in Centennial. And it'll have outpatient services too. That's
great. No, it's good to have that. On the east side of town, Henderson, for you viewers that are not from Las Vegas. Henderson is about a good half-hour drive from Las Vegas. It's like crossing the border to the other side. It is beautiful part of Nevada.
Yes, it is.
And I'm glad you're opening up a location there. A lot of folks really like Henderson. They don't know too much. They know everything's Las Vegas. A lot of them work in Las Vegas.
That's right.
But Henderson is a beautiful town.
It is. And then we also have our long-term acute care hospital over there by Mountain View Hospital in Tenaya. So that is a 79-bed long-term acute care hospital. So those are for the sicker patients like we talked about earlier.
You told us a little bit about that hospital?
Yes, a little bit. So it's on Tenaya. It is a 79-bed licensed facility. So those patients are typically sicker, 25 days plus length of stay. So they're there a little bit longer. They do have ICU level of care. Typically, they stay in their rooms a lot. So when they're ready for rehab, if a patient chooses to come to us, they can transfer to our facility as a sister facility.
Right.
We do have some of the same physicians, which is great. So there's a lot of continuity of care. So
Right.
I think that's important too.
Yeah, I know when I was in the hospital there, recovering from COVID, I was asking so many questions about what's going to happen when I get out. But one of the main things I want to know, when am I going home? When am I going home? I mean, 5 months in the hospital. I mean, 5 days is a long time. 5 weeks is a long time. But 5 months,
That's very long.
that's very long.
No wonder you lost weight.
Well, you know, you lose weight when you get the COVID is because you lose your taste, your smell, and all that at the beginning. You can't really taste anything that you're eating, and it was very difficult. But little by little, you know, I'm getting back to normal.
Did you
And-
get that back?
Oh yeah, I got it back right away. I said, man,
Okay.
God, I pray to God, give me my smell back and my taste. I want to eat again. And I got lucky. I got it back like 2 months later.
Oh boy.
Yeah,
Oh,
but it
boy.
was tough. So in 2 months, you can lose a lot of weight.
I should take some cues from you.
But I tell you, you people out there, you viewers out there, that these type of shows are so important because this is what's needed out there for you guys to learn more, not only about COVID, but about healthcare and rehabilitation in general. I want you guys to understand that there is life after illnesses. Sometimes people want to give up. Don't give up. Be a fighter. Be a fighter like I was all these years in my profession as a professional fighter. You learn that you can't quit. You know, it's easy to quit, but those that are real champions are those that keep going forward. That's where you can really prove to yourself and to the world that you're a true champion. Inside the ring, outside the ring as well, as far as I'm concerned.
That's right. It's important. You know, rehab should be viewed as getting your quality of life back.
Right.
And I think that's what we were able to do for you.
Right. Definitely. They made me feel like a champ again. And that's why I'm making my comeback, guys. Get ready. Those guys, a couple of guys that beat me in the amateurs, a couple of guys beat me, one guy beat me in the pros. You know what? I'm looking, I want to come back. I'm ready to make it come. That's how good I feel. I feel great.
You look great too.
You know?
So I think for our viewers, you know, if they have suggestions, comments, anything that they'd like to hear more about, I think you and I would be open, you know, to seeing what we can do to help.
Yeah. I want to see some of the photos, the ones you viewed at the Pam Rehabilitation Hospital, the workout facility, and there you have the building itself. But you got the inside where I do my therapy, and it's really beautiful. The reception area is beautiful. The lobby is great, and these are the rooms. You think you're staying in a Ritz-Carlton type of hotel when you're in those rooms. They're really beautiful rooms. Everything is modern, up to date. Everything that you can tell us about, walk us through some of these photos we have.
Oh yes, this is our therapy gym. And of course, our gyms are very well equipped with all the latest technology. So
Right.
we have two gyms. The one upstairs is for the inpatients, the ones that are staying with us overnight for, like I said, a week or so longer. Of course, there's some of our therapists in the dictation room. Of course, that's where they have to do all their documentation. Here's some of the therapists, their crew, you know, wearing their masks. We had a fun day where we wanted to celebrate and wear funny masks, right? It's exhausting sometimes wearing the mask all the time, so make it fun. And of course, our facility at night, it is a beautiful building. We've been open, and it'll be 4 years in December. So 4 years and going strong.
We're going to have a good celebration come December.
That's right.
Next month.
That's right. That's
Yeah.
right.
I tell you that I think that what you guys are doing, it is amazing. It's amazing. I mean, there's no words to explain. I can express how I feel about the Penn Rehabilitation Hospital. I mean, when I walk into that door, I feel like I got the best fan club in the world. All these guys follow boxing. Joe, they want to talk about fights.
Yep.
You know, they talk to me about my health care, but a lot of the guys want to say, Joe, your predictions on these fights that are coming up and whatnot. I said, you got to watch your boss, your executive director. You see her boxing in her ring. She got what it takes. And she was boxing the other day with that little exhibition with that young lady in the ring. It was really amazing.
That was a couple years ago.
Was it a couple of years ago
Yeah, it was
already?
a couple years ago,
Oh, wow.
yeah.
Well, I just got to see it last week. And I said, wow, I didn't know that you had such talent.
Yes, I was in an event. You know, it was a fundraiser event for
Okay.
the Independent Senior Foundation.
Okay.
So I did get in the ring Wasn't my best moment, but I got in the ring.
It was great. It was funny. It was hilarious. Because she was on the floor, and you were still trying to punch her. She was on our campus. I said, wait a minute. In real boxing, you get disqualified for that. But she was having some fun, and I think that was the best part of the whole video, of watching you knock your opponent down and trying to kick her and trying to punch her.
Yeah. Yes.
And Richard Steele was pulling your weight.
Yes, he was. He was trying to pull
Richard
me
Steele,
off
another
of
Hall
her.
of Famer. Good guy. Anyway, Pam, Sam, I want to say that the Pam location is, to me, like another heaven. You go there, you're going to feel like God's taking care of you. You want to go there, you want to find out more about the Rehabilitation Center, could you go to your website?
Go to our website at pamhealth.com, and our location is at 6166 North Durango Drive in Centennial Hills.
Phone number?
It's 725-223-4100.
Okay, fam, we'll see you then. Take care. We'll see you next
Bye.
week.